வாழ்க வையகம், வாழ்க வளம். So, respected guys, respected experts, respected Anandakumar Dhanasekaran, respected Rabindranath, Dr. Sundara Devi, Dr. Sundaramurthy, and dear scholars, brothers and sisters. I am really very much happy to welcome all of you for this webinar on science of Kayakalpa. So we have been conducting this science of Kayakalpa for a very long time, and so many doctors are helping us, particularly Dr. Sanmugavelu, Sundara Devi, and now the Anandakumar Dhanasekaran, Dr. Rabindranath, Dr. Jayaprakash, all are helping us. So many factors they are giving the details about that. So Kayakalpa is a wonderful subject in which we are making in-depth research over that. So doctors are very much helpful. Later on, whatever they say, we will analyze experimentally with some samples also. So in that way, today, Dr. Anandakumar Dhanasekaran, a senior doctor in UK, professor of Virginia University, the most resourceful research person today what we are having now. And his language is very simple, understandable by all the scholars, and also very much interactive with the scholars also. So I am very much happy to welcome Dr. Anandakumar Dhanasekaran for this webinar. I am sure is so after his, I think this calls to attend the session. Yes, this time, this evening 3 to 6 is not convenient for him. However, we made a request for the sake of the scholars. So today now he is available with us, and I am very much happy to welcome him on behalf of World Community Service Center and on behalf of our guides and the scholars. Next, I am happy to welcome Dr. Rabindranath, who has been instrumental in organizing such webinars, and Dr. Sanmugavelu and Sundara Devi. So their contribution have given us a lot of inputs in this case. So Dr. Jayaprakash is also given in-depth study here. So
recording in progress.
All our doctors, all our experts, and our guides, particularly Dr. Sundaramurthy, is attending regularly. And I also request all our guides and our scholars, please interact with the experts at the end of the session and make it very much useful. So with that, I am happy to welcome all of you once again. வாழ்க வளமுடன், வாழ்க வளமுடன், வாழ்க வளமுடன்.
Thank you, Ayya. வாழ்க வளமுடன். Now the special address by Dr. Anandakumar Dhanasekaran. A short introduction about him. He is a urology consultant, clinical effectiveness and governance lead for urology, deputy head of Academy, Sandwell and West Birmingham Hospitals NHS Trust, lead for urology MBCHP program, medical school, University of Birmingham and University of Aston, core urology postgraduate tutor in University of Edinburgh. Now I request Dr. Anandakumar Dhanasekaran Ayya to render his address.
Thank you very much for the welcome address. Today I was asked to present on sexual vital fluid. There are many presentations already done. In fact, Shankti Amma made a very nice presentation on sexual vital fluid few weeks back, and I have also seen the previous presentations. All those presentations were heavily relied on non-allopathic medical sources like sources from Ayurveda, sources from our old Tamil scriptures and others. They are very good. They have plenty of knowledge, But today, being an allopathy doctor, I'm going to discuss entirely based on the Western medicine or the allopathy medicine. It is important for our scholars to know the Western concepts in the correct terminology. There are a lot of similarities. Of course, there will be some small difference of opinions also. Some concepts are different, but if we understand both the concepts, you can understand that the truth underlying everything is almost the same. I have recorded the presentation because there is a small possibility I may have to leave bit early. So the recording will run for 40 minutes. I will try to stay as much as possible and answer any questions. If I have to leave, I will inform Shanti Amma so that she will collect the questions and I will clarify the questions on a later date. Scholars who are following this video, don't get apprehensive that so many new scientific terminologies are introduced in this. I will try to make it as simple as possible with as many diagrams as possible. If you are able to follow this video and also use this as a revision tool, once you get a link for the recording, it will give you a complete picture of sexual vital fluid from the allopathic medicine teaching. It will also give you a very good idea when you are presenting your PhD thesis or any poster or podium presentations in national and international meetings. You can use the proper accepted Western English terminologies, which will certainly uplift the quality of your presentations. I will share my video now. At any time, if my volume is not enough or if there is any disturbance, please feel free to stop me so that I can present directly. Good morning, everyone. Today, we are going to discuss the topic sexual vital fluid. As we discussed in the previous few webinars, sexual vital fluid was very immensely described by our Maharishi. It is the main component which we are discussing when we are showing the origin of the biomagnetism in our Kaya Kalpa practice. I'm going to keep this full lecture completely on the medical side of the sexual vital fluid. So you will understand the anatomy, physiology, hormonal control, various stages in the development of the sperms, and ultimately you will get the full medical knowledge on sexual vital fluid. Unfortunately, since I'm going to discuss in a complete medical manner, there will be many new terminologies. I am sure for the scholars who are preparing for PhD and higher theses, these terminologies will be very useful. I'm going to share this whole recording both as a YouTube link and a separate video. I will also send the PowerPoint slides so that you can use this to revise and improve the knowledge. Lot of the things what we discussed here were not very well discussed in our Maharishi's teaching or the yoga college teaching because they are all not based on Western science. It is very important to get the complete knowledge of the Western science so that in the future when you are presenting your work on sexual vital fluid and Kaya Kalpa, you can discuss with appropriate terminologies and up-to-date knowledge. Once you complete this full video, you will be having complete knowledge of the sexual vital fluid from the medical point of view and you don't have to use any other reference. Let's go in.
The things we are going to discuss were anatomy, physiology, about sperms, how the sperm forms, what are the name for the early forms of the sperms, etc. Hormonal factors which controls the sperms, functions of the seminal vesicle. In case of the sexual vital fluid, if we are understanding as if a kind of vital fluid stored in the lower Muladhara area, it is the seminal vesicle. We need to understand the functions of the seminal vesicle in clear. And semen, which is the ejaculatory fluid coming out from a man. Let us start from the anatomy of the testes. As you see here, follow the arrows. I will try to open laser color also, so that's much more easy to follow. So this is the testes. The testes consist of 900 coiled seminiferous tubules. You can see this is one seminiferous tubule, this is one seminiferous tubule. So we are seeing the cross section of the testes, and it contains 900 seminiferous tubules. So what you are seeing is like a magnified view of the seminiferous tubules. Each seminiferous tubules is 1.5 meter long. These are all the places where the sperms are formed. I'm going to discuss the cross section of the seminiferous tubules so that you will understand this much better in the next few slides. Once these seminiferous tubules forms the sperms, they empty by their individual seminiferous ducts into the epididymis. Epididymis is the structure present behind the testes, and the epididymis is approximately 6 meters long if you uncoil it. This epididymis leads to the vas deferens. So if you see the shape of the testes, which we know, it consists of 900 coiled seminiferous tubules, and they all join together to form epididymis. The first part of the epididymis is known as head of the epididymis, which is in the upper part. And then we have the body of the epididymis, and then we have the tail of the epididymis, which constitutes as the vas deferens. The testes has got testicular artery, which supplies blood both to epididymis and the whole testes. The epididymis leads to vas deferens, and vas deferens enlarges into a place known as ampulla before the vas deferens enters the prostate gland. I will explain that with the next picture. So we have seen the magnification of the testes, epididymis, and the vas deferens. Vas deferens goes into the pelvis behind the bladder, and it enters into the prostate. This area is known as ampulla of the vas deferens. Ampulla means slightly bigger. And you can see that in the same area we have the seminal vesicle also. Even though in this picture seminal vesicle is marked quite small, based upon the content storage, seminal vesicle can get bigger also. So we have two seminal vesicles for both sides. They are located on each side of the prostate. Prostate is only a single organ. And the seminal vesicle also empties into the prostatic end of the ampulla. So the ampulla has got prostatic end. And then it forms the ejaculatory duct. The ejaculatory duct opens into the urethra. So this is the urethra. So this is the bladder in which the urine stores. This is the bladder neck. And then we have the prostatic urethra. Once the prostatic urethra is completed, we have the starting of the bulbar urethra, and then membranous urethra, and then the penile urethra. This bulbo-membranous urethra is the one where the sphincter is working. The sphincter is the one which we are constricting during the Kayakalpa exercises. Since the muscles are here and we are constricting them, it indirectly gives enough stimulation to the prostate and the seminal vesicles also. When a man has ejaculation, what are all the constituents of it? The ejaculation contains the fluid from the vas deferens, which is directly coming from the testes. The ejaculation will have fluid from the seminal vesicle. It has secretions from the prostate, which opens by multiple prostatic ducts opening directly into the ejaculatory duct. And in the urethra, we have bulbourethral gland, which is known as Cooper's glands. So these glands also have the secretions which constitutes the ejaculate. So the ejaculation consists of from these four areas, which we will discuss much more in detail. Now we are going to discuss the physiology of how these seminiferous tubules work and how the sexual vital fluid is produced. So this is the cross section of the seminiferous tubules. So just to understand, this is the seminiferous tubules. If you take one seminiferous tubule and if you cut it, you will see like this. There is one seminiferous tubule and there is another seminiferous tubule here, another one here. There are multiple seminiferous tubules around. During the formation of an embryo, the primordial germ cells, this is another term which was used by Maharishi quite often, the primordial germ cells migrate into the testes and become immature germ cells which are known as spermatogonia. As I said, I will be giving a lot of medical terms. It is better to understand as much of terms. Maybe you can use this video YouTube link to revise again and again so that you are confident with these terms. When you are presenting your papers in a national or international forum, you should use the correct terminology. That's very important. So these spermatogonia are present here. Spermatogonia are formed from the primordial germ cells. The spermatogonia, as you can see, it forms one or two layers of the surface, layers of the cells in the surface of the seminiferous tubule. This is one seminiferous tubule. At puberty, say 13 years for a boy, the spermatogonia began to undergo mitotic divisions. I will explain what is mitotic division and meiotic division. There are two types of divisions happening. We will discuss this in detail with a flowchart. With mitotic divisions, it will divide and proliferate. This forms the different stages of the sperms. And the final sperms are forming here. You can see the sperms with the long tail. The final sperms are forming in the lumen of the seminiferous tubules. There are various hormones which is responsible for the stimulation from the spermatogonia into the sperm. Usually this starts average at the age of 13 and continues throughout a man's age. But the function of this seminiferous tubules is decreased a lot in the older age. So a man has no specific time period like menopause for a woman. In a woman, there is a period maybe around 60 years or 55 years or 50 years, menopause happens, after which there is no ovum. The menstrual cycle completely stops. But for a man, this sperm production continues throughout the life in theory, but in older men, more than 60 years, more than 70 years, the amount of the sperm production is very, very low. Okay, so these are all the things we need to understand. Now we understood the cross section of the spermatogonia and the seminiferous tubules. Now I'm going to take the cross section like this. Okay, so understand that we are going to see in the next slide a cross section in this area. Okay, so this is that. If you see, it's like a watermelon. So if you take this as a watermelon, I'm taking a slice of the watermelon and showing you like this. So please understand that clearly. It's very important to see that there are some Leydig cells present outside the spermatogonial cells. It's very important to understand because Leydig cells are important in producing testosterone, which is the main male hormone. Now here in the cross section, you can see the various areas or stages by which a sperm is produced. The first stage of the spermatogenesis, the spermatogonia migrate among the Sertoli cells. So you are learning two different cells which are not related to direct production of the sperm, Sertoli cells and Leydig cells. Leydig cells were present outside as seen here. They produce testosterone. Sertoli cells are present within the seminiferous tubules. They are very important in producing enough nutrients for the growth of the spermatogonia to the sperm. The spermatogonia has to grow and cross the barrier of the Sertoli cell layer to become a primary spermatocyte. If you see, primary spermatocyte is much larger compared to the spermatogonia. Each primary spermatocytes in turns undergo meiotic division to form secondary spermatocyte. Now we will see what is mitotic division, what is meiotic division. So spermatogonia to primary spermatocyte is mitotic division. Mitotic division is very simple. One cell divides into two cells. Both the cells will be as same as the first cell. That is mitotic division. It comes with the letter T, mitotic division. For example, in the skin, one cell divides into two cells. Both the cells will be same as the previous skin cell. So that is mitotic. Mitotic division happens most parts in the body. But here in the primary spermatocyte, which is much larger, as you can see, when it divides into secondary spermatocyte, which is almost half of the size of the primary spermatocyte, the division happening is known as meiotic division. Meiotic is the one where a cell is divided into two cells, but the chromosomes will be only half of the primary cells. So the primary cells chromosome will be half in the secondary spermatocytes. I will discuss this further. Since the chromosomes are half, when a man's sperm combines with a woman's ovum, which also got half of the chromosome, it joins to form the primary embryos, which has got the complete pairing of the chromosomes. So this is how a man gives half of the chromosome and a woman gives half of the chromosome for the baby. So it's very important to have the half and half, which becomes the baby. So each division of this primary spermatocyte into secondary spermatocyte is by meiotic. Okay. Another few days time, this secondary spermatocyte also further divides to form spermatids. From this, the sperms grow. So this takes another few days here. During the stage from the spermatocyte to the spermatid stage, as we discussed, the 46 chromosomes will become 23. So only one half is from the father, and the oocyte provided by the mother gives the other half of the chromosome. The entire period of the growth of the sperms from spermatogonia to spermatozoa takes 74 days. So almost 2 months it takes for the sperms to form. In women, we know that during every menstrual cycle, every 28th day, they will be having one ovum which is released. Okay. So in this flow chart, you can see that the primordial germ cell, it enters the testes and stays as spermatogonia. This is the spermatogonia. And the spermatogonia remains dormant from birth to puberty, so approximately 13 years. And spermatogonia divide by this mitotic division into two cells, form the primary spermatocyte. It is mitotic. As I said, mitotic means the same cell will become two cell. The same chromosome, 46 pairs will be here in 46 pairs. This primary spermatocyte undergoes a meiotic division. See the change of spelling here. It becomes secondary spermatocytes. In the meiotic division, we have 1 and 2, two divisions. In meiotic division 1, the same pair is maintained. In meiotic division 2, you can see that the pair has become half. Only half of the chromosome is maintained. And they are known as spermatids. As you can see here, they are all spermatids, which is not fully developed. From the spermatids, you can see the sperm, which is nicely developing. And these spermatids grow into the mature sperm. Now we understood the anatomy and how this sexual vital fluid, the main component, the sperms are produced. Sperms are the only live things in the whole sexual vital fluid. Now let us learn the single sperm in detail. Okay, a sperm consists of head and the tail. As you can see, head is the main component, but it's quite small, and tail is the long component. When spermatids are first formed, the spermatid as such is just like any epithelioid cells. So epithelioid cells present in the skin, nail, anywhere, like epithelioid cells. And then changing into this elongated spermatozoa is very important in maintaining the potency. So if you see from the epithelioid cells, we are getting these spermatid sperms which are quite differentiated. So it has head. The head contains a thin cytoplasm. If you see, the amount of cytoplasm is very, very thin. Because the aim is not for the cell to further divide and grow. Cytoplasm is very important only in those aspects. The nucleus is very important in carrying the information. So that's why the nucleus material is very larger and cytoplasm is very, very thin cytoplasm. The most important thing you need to understand is in the head there is a very strong layer by name acrosome. It has got a lot of enzymes like lysozymes and proteolytic enzymes. This acrosome is important in the sperm penetrating the ovum. So if the acrosome is deficient, then you will be having sperms, but they are not good enough to penetrate the ovum, and that's where the infertility and other problems comes. And the hormones present are hyaluronidase and protease. These enzymes play important part in fertilization. And the tail contains 3 parts. There is a central skeleton which consists of 11 microtubules. They are called axoneme. And there is a thin membrane which covers the axoneme. And there are multiple mitochondria. You can see that. And we know that mitochondria are the powerhouse for a cell. The energy produced by mitochondria only keeps a cell working. This mitochondria present in all the cells, but since sperm needs to be traveling in the male genital tract as we discussed, and also goes into the vagina and female genital tract, it needs a lot of energy. So that's why we got so much of mitochondria which will produce enough energy for the sperms to move and mobile. This tail of the sperm makes the back and forth movement, which is known as flagellar movement, which is important for the sperms to travel. Usually the sperm travels in the speed of 1 to 4 millimeter every minute. So if you see in a slide, every minute it travels 1 to 4 millimeters. Okay. If there is a problem in producing the normal sperm, this is the normal sperm, nicely developed head with a long tail. If there is a problem, you will get various deformed sperms. These are all deformed sperms like 2 tails, 2 heads, very small ineffective sperm, tail which is coiled, not opening up, short tail, and you can see all these are all diseased sperms. So if a man who is maintaining good health, he will be having healthy sperms like that. That's why when we are reading the sperms in the a slide of a man who is coming for infertility treatment, etc., we will see what is the percentage of the normal sperms. It's normal to have some abnormal sperms because not every sperm will go into the normal airway. Okay. There are some hormones which is responsible for the sperms to develop normally. So you need to understand mainly the 5 hormones. The first one is testosterone. As we discussed before, testosterone is produced by the Leydig cells which is present in the interstitium of the seminiferous tubules. So this is the seminiferous tubules. If you see in other cuts, this is seminiferous tubules. In this interstitium is the Leydig cells. The Leydig cells produce the testosterone. Testosterone is very important, as you know, that what makes a man into a man, and that is the main hormone. It is very important in the stages of the sperm formation. Luteinizing hormone. It is a hormone produced by the anterior pituitary. It stimulates the Leydig cells to produce testosterone. So luteinizing hormone is from the anterior pituitary. So that's where we are discussing the Agna chakra. So the anterior pituitary produces luteinizing hormone. Another hormone produced by the anterior pituitary is follicle stimulating hormone. This follicle stimulating hormone works on the Sertoli cells. So if you want to recollect what is Sertoli cells, we have seen that the Sertoli cells are present, which is important for the spermatid to go into sperms. So we have Sertoli cells inside the lumen, and the outside is the Leydig cells. Sertoli cells is stimulated by the follicle stimulating hormone, while the Leydig cells are stimulated by the luteinizing hormone. Both these hormones are from pituitary. So that's the main link from the Agna chakra pituitary to our testes. We all blankly say the secretions of the Agna chakra is important. We need to focus on the Agna chakra to strengthen it. That's what controls the whole body. But how it is controlling is through these 2 hormones: luteinizing hormone, follicle stimulating hormone. Estrogens are produced from the testosterone itself by the testosterone cells. If you see historically, they say Adam and Eve, and Eve is the woman which is formed from one of the ribs of the man. Okay, from a man, a woman is formed. It is not just the belief in the Hindu mythology or Christian mythology or by the history. Even in the normal man who has estrogen, which is a female hormone, the estrogen is derived from the testosterone. So now you can understand that medically everything is correct. If a man is too much obese with a lot of fat, these fat areas, especially in the mid tummy area, fat is very important in converting the testosterone to estrogen. That's why people who are very fat will develop breasts. We call it as gynecomastia, which means a male having breast tissue getting developed. It is because of the estrogen. It is very commonly seen in the very obese people where the testosterone is converted into estrogen. Okay, so a woman is formed from a man. A woman hormone is formed from the man's hormone. You can correlate spiritually also. That's why I'm trying to stress on those things. So estrogens are formed from the testosterone by the Sertoli cells. And then we have growth hormone. Growth hormone is also from the pituitary. So you can see from the pituitary we have 3 main hormones. The growth hormone is very necessary for the background metabolic function and overall growth of the testes. If the growth hormone is not there, the whole testis will go shrinking. So inside the testes, Sertoli cells, Leydig cells, they are also controlled by pituitary. But overall growth of the testis itself is also controlled by the growth hormone, which is from the pituitary. So we will see them in the next few slides. Physiology of the mature sperm. How a mature sperm will work. A normal motile fertile sperm is capable of the sphagellated movement of the tail. It moves at 1 to 4 millimeter, as we said, every minute. The activity of the sperm is enhanced by the neutral or slightly alkaline medium. The ejaculation of the sperm should be alkaline. It can be mildly acidic, in which the movement is inhibited. A strong acidic medium will cause death of the sperm. So alkalinity is very important. If you see various, some of them, you may be a allopathic doctor, there is always a stress on reducing the acidity in the body and keeping the body slightly alkaline. This is the reason for it. So a sperm will work well, will move well, will function well only in the slightly alkaline medium. The activity of the sperm markedly increases with increase in the temperature. So when the man ejaculates inside the woman's uterus, the temperature will be slightly higher, and it will cause increase in the rate of metabolism. It will cause the life of the sperm to be considerably shortened if the temperature is too high. The sperm can live for many weeks inside the genital ducts of the testes. In the testes, a sperm can live for many weeks. That's why if a man ejaculates, then he will be having one set of sperms ejaculated, but the sperm produced can stay there for many weeks. But once it is ejaculated, once it is in the female tract, it can stay only for 1 or 2 days. That's why in infertile people, they need to have the sex in the appropriate 14th day, which is the midday in which the ovum is nicely developed, so that the fertilization will happen. So if they have the sex, if they are able to calculate the 14th day and have sex in that 13, 14, 15 days, presence of the sperms which will stay for 1 or 2 days, so that the fertilization chances are very high. So you can use these things when your patient is coming for infertility treatment. Unfortunately, this 14th day should be 14 days before the next menstrual cycle, which we can't say when the menstrual cycle is going to happen. So that's why we calculate the 14th day approximately from the past menstrual cycle. That's why if a woman has a perfect 28-day cycle, the chances of calculation will be very successful, and chances of pregnancy is also very successful. Okay. Now we are going to discuss a little bit on the seminal vesicle. What is a seminal vesicle? I will explain again. So seminal vesicle, there are two seminal vesicles. If you follow the arrow, they present on both sides. Seminal vesicle is the storehouse of the sperms, and then they help in ejaculation. They constitute 30% of the ejaculate. Okay, 60%, 30 to 60% of the ejaculate. This seminal vesicle was mentioned in Tamil as Jeeva with Kulambu. Okay, I will try to get some Tamil words so that people can correlate. Jeeva with Kulambu. So what's happening in this seminal vesicle? Let's see. So each seminal vesicle is a tortuous bag-like structure, is located with secretory epithelium. It secretes a mucoid material. Mucoid means, in Tamil, if you want to say, just like chali is a mucoid material. It contains abundance of fructose, citric acid, and nutrient substances like prostaglandins and fibrinogen, which is helpful for the sperm's nutrition. But if you see fructose, citric acid, prostaglandin, fibrinogen, the citric acid makes the seminal vesicle constituent bit acidic. Okay, so as we said, we always wish the sperm to be a little bit on the alkaline side. This seminal vesicle makes it slightly acidic, but there are other mechanisms which neutralize that. In the process of emission and ejaculation during the sex, when the ejaculation happens, the seminal vesicle empties the contents into the ejaculatory duct after vas deferens empties the sperms. So during the ejaculation, what happens is, if you see in this picture, the vas deferens coming directly from the testes, it first empties here, and then the seminal vesicle empties its content. Okay, so that is the order in which the ejaculation happens. And the action adds greatly to the bulk of the ejaculatory fluid. If a patient has problems in the seminal vesicle, they will have ejaculation, but the ejaculation will be very small amount. And seminal vesicle, as I said, because of the fructose, has got good nutrient values. And there are prostaglandins. There are two uses for prostaglandins. The prostaglandin makes the female cervical mucus more receptive for sperm movement. Prostaglandins makes the mucus good so that the sperms will move and help in copulation and help in the fertilization. In the female tract, if you see, the ovum produced and then stays, and then ovum needs to come out in the menstrual cycle. The seminal vesicle needs to go against the stream. So this backward reverse peristaltic is helped by the prostaglandin. So prostaglandin helps in reverse peristalsis, and also it makes the female tract nicely receptive for the sperms to join. Prostate gland. You have seen the prostate gland already. I will just take you again. So prostate gland is the one through which the everything opens and prostatic urethra, and then the ejaculation happens. This is the prostate gland. What are the functions of the prostate gland? Prostate gland also secretes a thin milky fluid which contains calcium, citrate, phosphate, and clotting enzymes and fibrinolysin. During the emission, again, prostate gland also contracts simultaneously with construction of the vas deferens, and this thin milky fluid from the prostate glands add further bulk to the semen. So the milkiness of the ejaculate is due to prostate. The mucoidness is due to the seminal vesicle. So you know that sperm is milky in color and mucoid. So now you know what is the reason for which glands. The main important use of prostate is it is alkaline. It is very important for successful fertilization to ovum because we need an alkaline environment. So whatever happening, the other areas are all acidic. So prostate gland makes the ejaculate alkaline. Even the female vaginal secretions also little bit acidic, 3.5 to 4. So this alkalinity is mainly by the prostate. It increases the pH up to 6 or 6.5. Because of the slightly alkaline prostatic fluid, it neutralizes the acidity of the other seminal fluids, and also the alkalinity in the female tract. Alkalinity increases the motility of the sperms. I don't want to make it very complex, but if you want to understand the Jeeva Vittu Kodambu and sexual vital fluid, you should understand these things. I know a lot of things you need to hear again and again so that you are very comfortable with the terminologies. Sperm is a single cell. Semen is the one which is the ejaculate. So semen which is ejaculated during the male sexual act consists of fluids from vas deferens, which is 10%, seminal vesicle, which as I said is a 60%, that's the main thing, which is storage, and prostate glands, which is 30%. And also the mucous glands, especially the bulbourethral gland, also secretes mucus. So 10, 60, 30, and the mucus from the bulbourethral gland. I will take you to the picture again. It's very important to understand what is sexual vital fluid. That's the main thing we are discussing. So a sexual vital fluid which is ejaculated consists of 10% from vas deferens, which is directly coming from the testes, 60% from seminal vesicle, so 10 plus 60 is 70, 30% from the prostate, 100. So 100% we are able to know where it is coming from. But apart from this, there are some mucus secretions from the urethral gland, bulbourethral gland, which is also known as copper gland. So now you know exactly what is sexual vital fluid, what is the anatomy, and how the physiology works. The average combined semen is nicely alkaline. It is 7.5. So every constituent is very important to maintaining the alkalinity. And it neutralizes the acidity in other portions of the sperms and also in the female tract. The clotting enzyme in the prostatic fluid keeps the semen intact in a mucus form. So if a man ejaculates, if you put it in a slide and see, it forms the mucus and stays there because of the clotting enzymes present in the prostate. It's not running away like water. This coagulum, when you enter into the female tract, it dissolves in next 30 minutes, 15 to 30 minutes by fibrinolysin, which is the enzyme present which we discussed. And this dissolving of the semen is very important in releasing that millions of sperms. Sperms can live many weeks for male glands, but once it enters the female, it can stay only for 1 or 2 days, which also we have discussed very well. When needed, for example, if a man has to do some sperm test, if he's collecting the sperm in his home by masturbation, he needs to keep it warm to his body temperature. So the best advice is to keep the sperm in his shirt pocket so that it's warm with his body temperature. But if somebody wants to store the sperm, it can be stored in the low temperature for longer period. If you're storing below 100 degrees, which is the freezing of the sperms, frozen sperms, it can be preserved for years and years. For example, if a young patient, 20-year-old, not married, if he's having some testicular cancer, and we usually get some sperms to freeze it so that even the testicular cancer, sometimes he will be losing one testis, or because of the radiation or chemotherapy, the other testis work also will be quite diminished. So the stored frozen sperm can be thawed and used for further fertilization. I think this infertility, freezing, thawing of sperm, that is slightly not necessary as of now. So our aim is to understand what is sexual vital fluid, what is that Vittu Kalam, which we are saying so frequently in the Kayakalpa, how the Ashwini Mudra, the exercise areas are so closely related to prostate and seminal vesicle, and what are all the constituents of this seminal vesicle content and also sexual vital fluid. That's the main idea of this presentation. Now we will complete this by understanding how the hormones, the pituitary hormones, are controlling the testis secretions and other things. So as you can see, the brain has got the hypothalamus and pituitary. So this area is now magnified. You can see that hypothalamus, and from the hypothalamus, a pituitary is hanging down like a cherry. Okay. And this pituitary contains two parts, anterior pituitary and posterior pituitary. Anterior pituitary is very important in our today's discussion. Anterior pituitary secretes the hormones which we discussed already, and the hormones are luteinizing hormone and follicle stimulating hormone. Luteinizing hormone helps the interstitial Leydig cells to produce testosterone. Okay, and follicular stimulating hormone stimulates the Sertoli cells, and they help for the sperms to grow from spermatogonia to mature cells. So this is how the pituitary controls everything. Okay, so pituitary is the area we are concentrating during the Agna meditation. So strengthening the pituitary is so important in controlling the testicular function in testosterone and secretions, and the semen secretion also. The testosterone helps in androgenic effects, which means that what makes the man into a man. Okay, androgenic effects. And the Sertoli cells helps in spermatogenesis, which is the sperm production. All these things indirectly inhibit the pituitary. If there are too much of testosterone, it inhibits the pituitary so that the luteinizing hormone will come reduced, and then testosterone also reduced. So they have a nice inhibitory mechanism. So pituitary stimulates, and if it is too much, it also inhibits. So that is another important thing. How hypothalamus controls the pituitary is by gonadotropic releasing hormone, GnRH, gonadotropic releasing hormone. So this is the upper half, gonadotropic releasing hormone from hypothalamus controlling the pituitary, mainly the anterior pituitary, and anterior pituitary secretes luteinizing hormone and follicular stimulating hormone controlling the testes function. So this completes the overall picture, what we need to know about sexual vital fluid, Jiva Vittu Kodabu, how the Kayakalpa works in maintaining the healthiness near the seminal vesicle, and what is the importance of the Agna Chakra and other things in the discussions what we did. I've taken all the pictures and details from a quite latest book released last year. It is known as Guyton Hall Textbook of Medical Physiology. It will be a slightly difficult book for those who are not trained allopathy doctors to read, but some of you may be very interested. The book is released last year. It is the 14th edition. When I was a student in the medical school, it had something like 10th edition or 9th edition, I think. So very good book which will tell a lot of information. You can learn much more also about the sexual vital fluid. So in summary, the main thing what we have seen is we discussed the anatomy of the testes. We have learned very clearly how the seminal vesicle, epididymis, vas and all is formed. We have discussed the main other anatomy of the prostate, seminal vesicle and the urethral gland. They form the main components of the sexual vital fluid. We discussed the kaya kalpa, means this is the muscle layer which we constrict. We discussed the cross section of the seminal vesicle which produces the spermatogonia and it matures slowly to form the sperms, and spermatid Sertoli cells are present here while the interstitial cells contains the Leydig cells. We discussed how spermatogonia goes by initial mitotic division to primary spermatocyte, and primary spermatocyte becomes secondary spermatocyte by meiotic division. I discussed mitotic, meiotic. The easiest thing is mitotic, which comes with T, is normal. The cell will become 2, just the replica. Meiotic means the cell will become 2, but the chromosome is halved. It happens in the region of the secondary spermatocyte. And this flowchart told us how the primordial germ cells become spermatogonia, primary spermatocyte, and when the primary spermatocytes become secondary spermatocyte, the chromosomes are halved. So half of the chromosome is coming from the father, half is coming from the mother. We discussed the structure of the sperm in detail. We discussed what are all the hormones control the sperms, and if it's not controlling, we get all these abnormal sperms. We discussed how a mature sperm work, why alkaline and other enzymes are very important. We discussed how a seminal vesicle works and prostaglandin works. And we discussed the semen, the exact constituent of semen and what is its life in a man's body, in a woman's body. In a man's body, it can stay for many weeks, while in woman's body, it is only 1 or 2 days. We discussed the hormone control from the Agna Chakra or the anterior pituitary and how the pituitary is controlled by the hypothalamus. And I showed you the source of the book also. I hope it is very useful. I know I have introduced a lot of new terms, but if any of you are interested to know everything about sexual vital fluid, I am going to do a good usage of these modern Western terminologies or allopathic doctors' book terminologies so that I can answer all the questions in the national or international forum. You need to understand these terms. It's very easy. Once you start learning it, once you start seeing this video again and again, you will be absolutely thorough in these terminologies. This is the allopathic side of the sexual vital fluid and Jiva Vitta Kodam. Thank you for hearing.
Thank you so much, Aya. A clear explanation.
Can I ask a question?
Yes, sir.
Yeah, see, we are talking about the male sexual fluid. What about the sexual fluid of the woman? How's Ashwini Mudra and this Ojas breath helping them to transcend their liquid?
Yeah.
Warm up regarding the warm. Yes, because it is easy to explain the male sexual vital fluid, but it's very difficult to explain about the worm in the woman. No?
I understand. Yeah.
Yeah.
So,
Yeah.
if you want to know the women equivalent of the sexual vital fluid, the easiest way is in a woman, the vas deferens testis absent, seminal vesicle absent, prostate absent. So, the only thing they have is the bladder and the urethra, which is very short, and the corpus gland are there. The glands which secrete the last small part in a male, the corpus glands are working in women. That's why in women, the glands, the emission or the climax, the ejaculation is very, very small. you'll get only a very small amount of ejaculate happens. And that ejaculate is more than enough. That is the sexual vital fluid for the woman. And they can develop it further with appropriate abstinism and Aindil Alavamurai. And they can use that energy to take it and then do the ojas breath. How ojas breath work? That's a different question. So regarding the ojas breath, it is known as a Venturi effect. I think in the previous presentation I showed that how if you are gardening with a hose pipe without much pressure, the water just flows down. But if you are using a proper sprinkler, it gives a nice sprinkling effect. So in ojas breath, we do Kesari Mutra also. There is a science behind that. That's a different topic. When you are doing the ojas breath, because of the pursing effect of the lips and between the teeth, that Venturi effect happens and that biomagnetism is nicely spread all over the body. If you take scientifically, it's very easy to think that in a man there is a jiva vittu kodambu which causes the more amount of energy, biomagnetism. So the Kayakalpa works more nicely in a man but not nicely in a woman. It's very easy to think in that way. What is important is whatever I discussed today is what is happening in the physical body. As I explained already, physical body, subtle body and causal body, that is very important. In the Kayakalpa, even though we use the Ashwini Mudra to make our concentration into the muscles of the pelvic so that we can nicely contract it, we will think about it, we will give our focus to that. The whole nadis which take the energy and then spreading happens is happening in the subtle body. Subtle body is same for man and woman. Subtle body, the nadis, everything is same. If you are trying to extrapolate that in the physical body, you will think as if the man has got good amount of physical sexual fluid substance. But if the whole thing happens in the subtle body, man and woman both are same. As far as the Kayakalpa is concerned, we know the living examples, people can achieve very good improvement equally in women also.
Bharga Valamudan. I request Dr. Swatantra Devi Amma to unmute and speak.
Bharga Valamudan. Dr. Ananda, you have given a very nice presentation, almost as a good teacher to the students. And I think the scholars will be really benefited about semen and sperm. So, but this is the point of contention in our group discussion, that sexual vital fluid, can it be equated to semen and sperm? So that is a point of contention. We have to talk about it and come to a conclusion. Because I really like the other person asked the question, it is really, you cannot explain it in the same way because the energy lost in the sperm and semen is much, much greater. With each emission, there are millions of cells. With one emission of anywhere between 50 to 200 millions of sperms are lost. And there is so much energy lost to make energy needed to produce that many number of sperms and that fluid. So that is where the men lose the energy and that is the cause for their problems and all that. In women, it is not like that. In the whole month, there is a little bit of fluid is lost, only one ovum and it is not lost. It is just there and it is reabsorbed. So no energy is lost. Some energy is lost due to the menstrual blood. So some amount of energy is lost. That's only once in a month. So it is definitely we are discussing in the group already before you joined that we cannot equate the sexual vital fluid with the semen and sperm. But we have to find out. We have to talk and we have to find out and we have to come to a consensus on this. And there's something called ojas about that. In the next meeting, I will talk. So that is more like the vital fluid. If you leave the word sexual, that is more like the vital fluid. That's what I think. I'll give the presentation in the next webinar. Varga Valamudan.
Thank you, madam. As I said, Perumal sir asked me to discuss the sexual vital fluid from the medical point of view and from the physical body point of view. I think this is also equally important to understand, but the actual kaya kalpa, the actual sexual vital fluid, as you said, is more to do with the subtle body. That's why we can't equate both directly to each other. And in women also, that ovum is, if it is not properly fertilized, it will be lost. And once the ovum is lost, the ovum is much bigger compared to the sperm. So the equation we can't do directly, but if you are able to understand the whole biomagnetism and whole procedure in the subtle body, it's very easy, because nobody can see anything in subtle body. Whatever we say is the correct thing. But the idea of the whole presentation is, now there won't be any doubt regarding the physical body aspect of what is maybe the semen, what may be the sexual vital fluid, etc. If we decide that this whole sexual vital fluid is nothing to do with the semen, I'm very happy with that. I'm very happy to discuss with taking only the subtle body into the discussion. But if you want to discuss this outside this Kai group into the followers of different belief or the Western people, we need to understand and we need to equate something with the physical body. Then only we can take them to understand what is the subtle body and take it forward. Thank you, madam.
Yeah, but this question will come always if you talk about semen. You will have to face this question everywhere, even in the medical field, everywhere. And if we are talking only about the subtle body, it won't work, because
Yes.
there has to be a physical component for it to act. Then the subtle body, that thing has to have some representation in the physical body. Like chakras, we say it's in the metaphysical body. But then we have hormones, we have endocrine glands in the physical body. So like that, we have to have something to equate with that, and it should be common for men and women. So that this is the point of contention, and that word is the point of contention. So unless we bring it out in the form of a book, we have to have a definitely plausible explanation.
Definite, madam.
What you have taught is about the male aspect. That is very good and very nice. Anyway, thank you.
Thank you, madam. If time permits, madam, I can explain this little bit further. So, as a man, I can say, if we ejaculate, after the ejaculation, for the next time, next morning, when you do Kaya Kalpa, there is very less energy, and you can feel the difference between the days where there is abstinentism and when you are doing the Kaya Kalpa. If a person is doing Kaya Kalpa within 6 or say 8 hours or even one day after ejaculation, definitely they can feel the difference. If they are very mindful in doing, first of all, they should do Kaya Kalpa correctly, very correctly. If somebody is doing correctly, they can easily see the difference. So personally, I am very convinced there is a definite link between the physical body, the seminal vesicle and the semen, which I have discussed today, and the subtle body's sexual vital fluid. If there is no difference, then we need to really change the term itself. Then the sexual vital fluid has nothing to do with the sex. It may be having some vitality, it may be having the fluidity, not even a fluid. So then the whole term will change, which we have discussed many times in the past. But in a man, there is a definite correlation. And sorry for the female participants in this group. If you permit, I will come out with my own thought. If you see, retrospectively from 2022, people who have achieved enlightenment, people who are like great sages, people who have done a lot of work in the spiritual work. If you take only our Tamil history or something like that, 95%, if not 99%, were women. There are very few people like Avayar or wife of Agathir. Very few women people have achieved these kind of successes. And very good respect to our Sudhandara Devi madam also, and all the female scholars who are doing the PhD and MSc program. So Is it correct then? So there is some disadvantage in females' physical body or subtle body with the biomagnetism slightly on the lower end. I don't know. I'm just letting out a very cautiously. I'm letting out this question, but this is a thought to think. You just like that. We want to make sure that the men and women should be equal. We should give respect to men and women. They are all, those are all very important. There is no doubt in that. But truth is truth. Whether really physical body wise, subtle body wise, is there any disadvantage for the woman? It's a very important thinking, and in my belief, I think there is something happening there. But I don't want to say very categorically depressing all the women in this forum. Thank you very much.
Thank you.
Dr. Sir, you've given a very nice description what we have expected that you have given today. Really, we're all very much happy. Actually, we have to go through it again and again, get it full depth. So really, we are very much thankful to you, sir. And similarly, Dr. Sodhara Devi, she has raised some questions. I think that for all these questions and answers, and you, the doctors, Shanmugavelu, Sundara Devi, Rabindranath, and you are then Jayaprakash, if you all sit together and discuss and bring out some more conclusive ideas, I think we, the people, we are not familiar with the anatomy and physiology of the body, and we will be very much happy. And also, whatever you give us a final concept, that we will take it to all the World Community Service Center professors when they are teaching Kayakalpa. I think they can add some more validity to their lecture, because they are giving that as what Sabuji has given that, and with the minimum experience, what they have got, that's all. But what you are giving today is elaborate, and you have given very good idea. Similarly, also regarding Asri Mutra, Mulabandha, Shanmugavelu given wonderful talk earlier, and Sundara Devi is very much simple. At the same time, when she talks, she goes to the depth. So such a wonderful experts we are having here. I'm very much happy that if possible, so what are all the doubts now we are having? We, the doctors, you can sit together and discuss and have some final conclusive ideas in that. So today also he said some difference with the men and the women.
10-15 minutes.
Yes, we
at least half
see the physical difference, the men and the women, at the age of 10, at the age of 20. So it's coming there. And also we find that in all the 10th standard and the 12th standard examination, for the past 30 years, I am seeing only the women students, they are getting high marks. They are the rank holders compared to the men. So there may be some answers with you for these questions. Generally, we say the women, as they are not going outside, no more diversion for them. So everything they concentrate and give it in that way, that may be a person. But we need some more medical the techniques behind that. Why but physically we know that physically the men are strong than the women, because due to the uterus and all the other developments for bearing a child, so the energy is getting diverted there. Physically there may be some difference, but mentally and intellectually the women are not inferior. I think they are coming there. So that can be also taken up. As Sundara Devi told that during the emission, millions of the sperms are coming out, but once in a month the ovum is coming out. Therefore, they are a little bit more conserved, energy conserved than this one. So that's also found to be somewhat reasonable. And at the same time, we would see that the ovum is much bigger than the sperms. So all these things to be taken into account, and how the energy conservation goes on, and how that is much connected with the consciousness and the intelligence or the lifestyle of the men and the women. So these all things are to be discussed, but you have induced the people to think over that. So this lecture is really fantastic, and you have given everything in depth, and we like it very much, sir. And I think there's some more participants, they are ready to make some questions. I think with all the questions, I think we can understand something more also. Thank you very much, sir. Thank you very much. And also, Amma Sundaradevi, you please write some more questions and bring all the details. Samuel Doctor is also here. I'm very much happy that only you can give some answers. You can give some solutions for us. So we are all little bit layman regarding this physiology and anatomy, and you are the experts, and you are to give a solution which is acceptable to all the people, and also which is convincing, which is scientific also. So Samaji has given, what Samaji has given, the Kagelpa, Srimitra, and the Vajas spread benefits, they're all common to all the people, both men and women. And somewhere they differed. In the vital fluid, they differed. Then the energy content, they differed. The intelligence, they differed. Even in the patience and the perseverance, they differed. So whether we have anything to be determined through medically. So that also, I think we all can think of. And however, I feel this discussion is a very much useful one. Thank you very much, Dr. Valka. Some more questions are from our students. Valka Valamadan.
Thank you.
Valka
Yes,
Valamadan, sir.
Valka.
Shanti madam, just 1 second for me. Sir, on the explanation what you said, again, it is nicely fitting with what we have discussed. So in the man and woman difference in the physical body and subtle body, maybe in a man, since a man has got nicely developed seminiferous tubules, penile organ for sex, prostate, everything, the energy distribution is more towards the Mooladhara and more towards the Swadhisthana. That's why usually man is the person who proposes and who tries to have sex. And if you take the rape cases, mostly it's because of the men, but it can happen with the woman also raping a man, but mostly with the men. And because of that physical body appearance, the subtle body also, man has got more energy in the lower chakras, and so if they do the proper kaya kalpa, they are really diverting so much of stagnant energy into the higher chakras and achieving or getting such a very excellent outcome. While in a woman, in the physical body itself, as Sudhindra madam said, the ovum is releasing only one ovum every month, so the energy is nicely conserved. So in the physical body, the energy is already distributed more into the higher chakras. In the subtle body of a woman, the Agna chakra or Turiya chakra or higher chakras will be having, including the Anagata chakra, will be having already a nicely established energy source. That's why a woman is always kind, lovable, kind-hearted, and a little bit calm, and they are more intelligent, they are able to focus more in the studies. So if you see from the life what is happening in between the men and women trait and the possible reasons of this one, everything is matching. In my eyes, I'm very comfortable with the discussion what we are happening, and the doubts are slowly dwindling, but we need to accept it. It's not just 2 or 3 people making and joining a statement. Okay, in a man, the energy distribution is more in the lower chakra and he can push it into the higher chakra. He can achieve very good results. In a woman, whatever I said. So it has to be a collective acceptance so that we can pass on the message. In my thinking, it is very good. The biomagnetism is nicely dispersed in higher chakras in the women naturally itself. That's why they are more lovable. They are the symbol of love. They are the symbol of intelligence. They are scoring always better than men in 12th standard, 10th standard. Not only in Tamil Nadu or India, even in Western countries, women study better than men because of less diversion. So in my eyes, it's quite getting clear, Perumal sir.
Very good, sir. So you mean the energies in the chakras, they differ for men and women. Am I correct, sir?
That should be, sir, because if you take a chakra, like for example, like Anagata chakra, which is more to do with the heart and the thymus, the chakra may be the same, but the woman has more energy distribution in the Anagata chakra compared to a man. That's why a woman always more lovable, having a pet, or maybe good in donation and very good in taking care of a newborn child. So woman is more good compared to a man. I mean, these are all like I'm telling an untrained prototype woman, prototype man. Yeah, a man can also become very, very lovable, can become very kind, can become very altruistic and good in giving love, etc. But as a prototype, the difference is because of that. A man's energy is more towards the Muladhara, Swadhisthana chakras. That's why the amount of food eating will be more in a man, amount of sex interest will be more in the man, or searching for those things will be more in the men. And the woman will be a little bit on the subtle side. So I think it makes a very good understanding, and we need more acceptance. That's the only thing pending.
Very nice, sir. I think even we can make research over these differences between the energies and chakras between the man and woman, and their behavior pattern and growth, lifestyle. I think everything we can relate. So from your lecture, I feel that
Yes, sir.
we can relate everything.
Yes, sir. There are some instruments available to measure the body aura, biomagnetism. So but the problem is, how good is the machine? Is the machine is correctly working or not? That's a question. The validation of that instrument itself is a study. First, we need to validate the machine, make sure that that is correct, and then if we recruit, say, 20 men, 20 women without doing Kaya Kalpa, 20 men, 20 women after doing Kaya Kalpa, maybe we can follow the same group, and we can see that in a man the energy distribution is more on the lower chakras relative to women. I'm not saying that women have no energy in the lower chakra, everything in the higher chakra, not like that. It's all relative. And by proper Kaya Kalpa, what is the change happening in the men and women? It's a very nice study, but we don't have the excellent standardized equipment to measure that biomagnetism aura. If you're able to measure at different levels, we can prove it in an experimental manner. But theoretically, when you speak, this all makes sense. It makes very good sense to me, and that's how the belief in Kaya Kalpa is becoming more strengthened now.
Very good, sir. It's nice, sir. What other instruments now available to measure the energy of the chakras, sir?
Sir, it is known as something equivalent to the infrared measurement agent. I can send you the link and also the scientific articles published on the measurement of aura. Most of them were done in the Buddhist community, where the people who are meditating, they are measuring this aura. They are even seen different colors and the length of the biomagnetism, length of a person's aura. Historically, they used to say, for example, for a Buddha, his aura is spread for streets, many streets, or even the whole city, where if he stays in one house for that few weeks in his travel, in that few weeks, the whole village will become happy, nobody will have the temptation to quarrel, and the whole thing will be peaceful. And I felt in myself that in a street, because we do a lot of meditation in the England, in this area, in the streets where even 2-3 people are meditating, that street people are relatively happy. The children score better and the things are slightly better actually. But the problem is the instrument is not properly quantified. The best thing is using the PET scans and functional MRI scans. Functional MRI and PET scans, they measure the actual function happening. For example, if you do for the head, if I'm thinking about something, it will lighten up in my frontal lobe. If I'm seeing some nice video or something, then it will lighten up in my occipital lobe, where the optic centers are there. So because of the functional MRI or the PET scan, we can map out which part of the brain is acting during the specific actions. So maybe we can use that, but the problem is how far it will penetrate to get into the pituitary to pick the biomagnetism. It's a very difficult one. We have got a wonderful theory, and the theory seems to be nicely applicable to our day-to-day scenarios, what we are seeing, but how to quantify it is the important one. I will send you some articles on the biomagnetism done for the Buddhist meditators, sir. Let us see whether we can get some equipments and ask some scholars to do some study on that.
Okay, sir. Okay. Thank you. We'll proceed, sir. வாழ்க வளமுடன்.
வாழ்க
Now
வளமுடன்.
you
Thank
can
you.
go for some of the questions, ma'am.
Okay, yeah. I request MSc student Vipin.
Ma வாழ்க வளமுடன்.
வாழ்க வளமுடன் ஐயா.
One point I just wanted to tell Dr. Sir.
Yes ஐயா. Yes, you can. Continue.
Sir, வாழ்க வளமுடன் sir, Dr. Ananda sir, Dhanasekaran sir. Excellent session, sir. A wonderful session. Nicely explained, sir. But 2 points I have noted. One, the points were in depth. One thing. Second thing, like our simplified Kundalini Yoga, simplified physical exercise, it was so simple that anyone can understand. The terms, words, sentences, whatever you said. For example, if you take one sentence, you said the sperm travels 1 to 4 mm every minute. For example, I have told, like that each and every sentence, it was so simple that anyone can understand. The key terms like seminal vesicles, mucoid, prostate gland, semen, sperm, everything it nicely explained, sir. But one point I just want my students, our PhD scholars should put up more questions to you. That's what I feel, sir. That point I just wanted to tell at this occasion. So if others, if we ask 1 or 2 questions to you, they must ask 4 or 5 questions. Students should come up. Thank you, sir. Thank you so much, sir. A wonderful session, sir. Nicely explained.
Sure,
Thank
sir.
you, sir.
Thank you, Sundaramurthy, sir. I always get a little bit fearful when I am talking to the people who are not like allopathic medicine, because I should not unnecessarily use any very difficult terms. So I took a lot of time in preparing the slides, and I try to dwell a lot on the diagrams so that I will try to show everything in the diagram rather than just slides going with lot of words also. And if this is useful for the students, I am very, very happy for that. So
kindly share this, sir. Kindly share this in our group, sir. The
Sure,
full session, sir. Recorded one.
Yes, sir. I will.
Surely, sir. This record will be given to all the people, sir.
Yes, sir.
We will give it there.
Yes,
Okay, sir.
And similar to this, the main importance is once we finish the whole thing in Kaya Kalpa, the same science we can say for our simplified Kundalini exercises, our Deepa Pairchi, our Kannadi Pairchi, and everything has the same science. In fact, the Maunam has got so much of science behind it. So we need to make sure we take the allopathy side or the actual research side of it so that we can prove all Maharishi's principles in a full scientific manner. We have job to do. We have a lot of work to do.
Okay, sir.
We really, sir, we are planning for it. So actually, first we started with the Kayakalpa. We thought we can complete with some 2 or 3 weeks, but it's continuing for more than 20 weeks. Still, there are so many things are coming out. So once we will make it thorough over this Kayakalpa, then we will go to exercise, then medication. Similarly, that's drum casing, mirror casing. So Maunam, everything will go on, sir. So these alternate Sunday webinars, it will continue for a very long time. Then by the time we will bring all the facts, particularly all the scientific facts behind that. Surely we will move on that. வாழ்க வளமுடன்.
வாழ்க வளமுடன், sir.
வாழ்க வளமுடன். Thank you.
Excellent, sir.
Okay. Now I request MSc student Vipin Kumar to unmute himself.
Good evening, sir. Can you hear me?
Yes, Vipin Kumar. Yes.
Yeah, sir. First of all, thank you for your presentation, sir. And my question is, I would like to know your viewpoint on what is happening for a person who practices brahmacharya. Like the spermatogonia proliferation is absent, or like reverse the process of mitotic or meiotic cell division. What is happening according to your viewpoint?
Yeah. I won't say it is my view alone. I think it is also scientifically accepted view. And so it is not just my view alone. So as you saw in the final chart which I shown, that there will be stimulation of the pituitary by the hypothalamus by gonadotropin releasing hormone. Pituitary stimulates the testes by luteinizing hormone, follicle stimulating hormone, and that produces testosterone, and the Sertoli cells are useful in producing or helping the spermatogonia to become sperms. In a person who is doing brahmacharya, which means the amount of sperms which needs to be produced is becoming reduced first.
Yeah.
Because there is no ejaculation, the seminal vesicle is filled with the sperms, and since there is no ejaculation happening, slowly what will happen is the need for the sperms will come down. So the spermatogonia will not go for differentiation. The Sertoli cells will produce inhibin. As I discussed, I showed you also the inhibin is produced by the Sertoli cells. The Sertoli cells will produce inhibin because there is no need for the sperm to produce. The inhibin will inhibit the follicular stimulating hormone. So the luteinizing hormone production of testosterone will be still intact, but the follicular stimulating hormone will be stopped. And as Sudhindra Devi madam also once said, in abstinence, it is not that the sperms are produced but ejaculation not happening. It's not like that. The sperm production itself will get reduced. My concept in that is, since the sperm production is reduced, sperm production is one of the major energy expense for a man. So for example, if you take your life, you may be earning say 100 rupees. Of the 100 rupees, your main expense is your home rent and food. That takes the major one. And then whatever the petrol and for recreation, you may be spending smaller one. I'm just taking for an example. Similarly, for a man who is having a very calm life, the production of the sperm takes so much of energy, and if a man is not spending the energy in the production of the sperm, that itself will produce so much of excess energy in the lower chakras, which he can project into the higher chakras by doing Kayakalpa. That's why the Kayakalpa in a person who is performing brahmacharyam or abstinence will be much better compared to a family man who is having a sex maybe weekly once or twice a week or whatever is the frequency. So for people in the family life, we are advising a kind of middle path, have the ejaculation once in 2 weeks, so that you are not having the very non-family life of a brahmacharya. At the same time, you are not missing out the importance of this Kayakalpa. So my answer to your question is, person who are having brahmacharya, because of the less sperm production, the Sertoli cells will secrete inhibin, so follicular stimulating hormone will be reduced. So lot of energy is conserved in the lower chakras. So his Kayakalpa will be much more efficient compared to a person who is having a wife and having a sexual life.
So thank you, sir. Adding to this question, like usually while doing Kayakalpa, we like in our system says that Aindil Alavu Murai, right?
Yes.
So for a brahmachari, like the sexual life is not going to be a Aindil Alavu Murai, like because he's trying to like full abstinence, right?
Yes.
So can you connect this with like what will be the importance of Kayakalpa for a brahmachari?
Yeah, it's very important. Say, Aindil Alavu Murai. That's what the terminology itself is self-explanatory. In the 5 aspects, you need to keep within a limit. So of the 5 aspects, one of the aspect is the sex has to be proper and has to be of proper frequency, and it has to be with a proper person. There should not be any murai-kedana sex. That is one aspect of it. So in that aspect, that brahmacharya person give a big tick. He is scoring 100 out of 100. So let us take this as a Aindil Alavu Murai has 5 papers. Every paper has marked out of 100, out of 100, out of 100. So 500 marks, how much you are scoring. For a normal person, Maharishi has said, Aindil Alavu Murai, have 50% in everything, keep everything under control, so that you will score 250 marks out of 500. You will be a good human being. That's what Maharishi said. But if you are a good brahmacharyan person in the sex, you are scoring 100 out of 100. And let us take the next one as a food. In the food, if somebody is following proper one a day meal and taking vegetarian food, taking good vegetarian high protein food, he is scoring 100 out of 100 in the food also. So Aindil Alavumurai is like a spectrum. You can be a good Aindil Alavumurai or you can be in an excellent Aindil Alavumurai. So this is good. But we can't say as an organization which is helping the public to improve the quality of the public life to follow Brahmacharyam as a first choice. If you start saying a person to follow Brahmacharyam as a first choice, few things will happen. What will happen? Number one, lot of college students, lot of young people are following the Sky Yoga techniques, and the Brahmacharyam should come to them originally rather than from the Sky Yoga. And if they think that I went to Sky Yoga, they said Brahmacharyam is better, so I'm not going to marry a girl, I'm going to follow Brahmacharyam. What is happening? The parents will be unhappy, the relatives will be unhappy. People will start thinking that Sky Yoga has spoiled a man's life. So that's why Maharishi is so clear. If it is an organization, these are all the things we need to do. Our aim is not to make one person Brahmacharyam and take him to the level of Shiva. That is not the function of the organization. Organization should be to help everyone. Our aim is to select the mean normal people and uplift their life so that everyone will be having a good family life. Even Swamiji Maharishi has got an excellent family life. So that's why I will not say that with the Sky Yoga cap on my head, I will not say Brahmacharyam is the best way to live. But there is no doubt that Brahmacharyam scores 100 out of 100 in one limb of the Aindil Alavumurai.
Okay, sir. Okay, thank you so much.
Thank you, sir. Now I request PhD scholar Arjun to ask the question. Arjun, you are not audible.
Arjun, it is your time. You can unmute and ask questions.
He's unmuted, sir. Now I request PhD scholar Tom Wright to ask the question.
Yes, thank you for the opportunity and very enlightening session, Dr. Anand sir. And I want clarification from you regarding this feel-good hormones and neurotransmitters, which is very well linked with our whole body system and even the lifestyle changes, diet, exercise, and our meditation will be improving that hormones and neurotransmitters. So what is your view on this? Because you spoke intricate with related with the pituitary glands also. So I feel that these happy hormones and neurotransmitters also play a role in enhancing our sexual vital fluid, because when the chakras are balanced, these hormones should be improving and this neurotransmitters should be acting properly to maintain that feel-good factors. So what is your view on this and how far this is also linked with our system?
Yes, Amma. Very nice question. Thank you for your question.
Yeah.
We can label the feel-good hormones with the proper science terms against, like for example, endorphins, dopamines, they are all the proper terminologies for the feel-good hormones. So from now onwards, you can start using some terminologies. That the terminologies,
yes, serotonin. Yeah.
Serotonin, the terminologies and these hormones, these words, once you start using little bit more scientific correct terminology, at least within your group people, within the students group. When you are going
Yes.
to the public to tell that if you do Kaya Kalpa, you will get the feel good hormones, that is good,
Yeah.
because we don't want to use complex words in the
Go deep.
public.
Yeah. Yeah.
Yeah. So definitely there is a link between our Sky Yoga principles and the feel good hormones what you have mentioned. Say for example, if I take the Aindil Alavamurai, let me take the example of the fasting again, because it's very easy to explain the feel good hormones with that. So I've already shared with Sundar Devi madam and others that I take food only once a day. So my normal food intake is approximately 2 o'clock in the afternoon in my Saturday Sundays, and during the working days, once I come back from the hospital around 5:30, I will have my food. And my food is excellent sumptuous food, because I am having only once a day. I will have good amount of food in that time. So even in that one food, after during the eating, after the eating, the amount of happiness what I am deriving, amount of
Yeah.
dopamine secretion and satiety and satisfaction is so much. I never enjoyed that in the days when I used to take 3 times or 2 times of food. So this is for the food itself. Then what happens? Say for example, normal day when I'm having the food at 5:30. So there is no hunger till I go to bed. Usually I go to bed around 9 o'clock and I get up around 3:30. This is my usual routine. 3:30 when I get up, 3:30 to 6:30 will be like meditation, sky yoga, everything that will take 3 hours for me. I do few things like Surya Namaskar, etc. Then 6:30 when you go to the office, slowly at 10 o'clock you will start having that hunger. When you start having that hunger, what happens is our insulin will go down, and because the insulin is going down, the muscles and the fats will get nicely metabolized, and the fats will release the glucose, the glycogen will release the glucose.
Yeah.
That is known as gluconeogenesis, which means the glucose is formed inside the body, not from the outside, from inside the body. Once the gluconeogenesis happens, you will get a wonderful sweet taste in your tongue that usually a fasting person can enjoy. For example, for me, it's like morning 10 o'clock till around 3 o'clock or 4 o'clock in the evening, and 5 o'clock I will eat again. So this is the period where you have the hungerness, but the hungerness will slowly stop after a few months. You may suffer for initial 3 or 4 months, but that sweetness is the one because of the increased dopamine secretion. Truthfully, in those period, I can this whole slides and the preparation I did during those period only. So 2 days before, 3 o'clock to 5 o'clock, I prepared the slides and I understood and I formed myself an idea what to talk. So I was in the peak of my fasting, completing 24 hours. But your mind efficiency will be so good because you are working on your internal stored glycogen, and that's where your dopamine, serotonin, and all the feel good factors comes into place. And then you can take a lot of day-to-day examples. So if you see a child from the neighboring house, and if you take the child and if you cuddle the child, if you are happy with the child, that also gives that happiness. So the Kaya Kalpa definitely improves your stored ability to produce that hormones. So there is no doubt in that. The whole Sky Yoga practice will improve that hormone milieu in your body.
Okay, one more. I think one more eye-opener point which you have put laid down now, that glucogenesis causes that sweetness you told, no, inside itself. Whether we can call it as that amritam, like used to the saints used to say, no, without they will not be eating any food, but they will be living a longer. So this will be secreting or something. I don't know. I am having that blank idea whether it is called as amritam or what.
There are two concepts to this, Ma. One, when you are doing the fasting period, there will be gluconeogenesis. So the fat and glycogen stored in your body produces glucose. That glucose is the best glucose, because that glucose is produced within yourself compared to the sugar or any food which you're taking from outside. So that gluconeogenesis gives a good amount of purest glucose in the blood. Blood is supplying from head to toe everywhere, and the blood
Yeah.
is supplying to your tongue. That gives the sweet taste in the tongue. So this is the medicine behind fasting. As I said,
Okay.
the scientific basis behind fasting is a different talk. I will do quite in detail for 1 hour on a later day. That is one
Sure,
thing.
sure.
What you are trying to bring in is known as Bindu Nadam. That's another thing
Yeah, yeah.
which I learned from Dr. Sudhandra Devi madam. Bindu
Okay.
Nadam is the one which is secreted from the pituitary or pineal gland. So those
Pineal
who are
gland.
doing the Kesari Mudra, they can fold the tongue and they can stimulate back of the nasopharynx, and that secretes that Bindu Nadam, and that is also told us a very good sweet taste product which will make Sudhandra Devi madam has got a very nice poem on that. வயதானவர்களும் வந்து யங்கா இருப்பாங்க, அவங்க வந்து வாலிபரா இருப்பாங்க. I'm not able to recollect the Tamil poem
Yeah.
which madam gave me last time. So both are slightly different, but if there is a real saint living in a forest, eating in a very less amount once a day, so they may say both as a sweet secretion, but
Sweet
both
secretion.
as scientific background behind it.
Background. Okay, thank you, doctor. Thank you. Because estrogen and progesterone are also that happy hormones only. So it also should be maintained. If our sexual vital fluid is quality and quantity is good, then I think that also will be normally balanced and it will be very good. And our life quality will also be increasing. So that's why I thought of asking you. Thank you.
Madam, progesterone is a part of a hormone which keeps us comfortable, focused, etc.
Yeah.
The estrogen is a kind of a sexual hormone. So make
Sexual hormone.
estrogen and testosterone as a sexual hormone. Progesterone, you can say like that. For example, in the presentation itself, I showed you how much of progesterones and prostaglandins were used in this whole process. So if somebody is doing a abstinence and forming a brahmacharyam, so much of prostaglandins he will be saving it, which he can use it for his feel good factors.
Since estrogen will become very less when women are in depression. So this also causes that even infertility because of depression. Estrogen production will become. That's why that whole concept brought me to ask you this clarification. And thank you for clearing my doubt. Thank you. வாழ்க வளமுடன்.
Thank you, Ma. Now I request PhD scholar Arjun to speak. You are not audible, Pa. Arjun, your voice is not audible.
Shanti Amma, when Arjun is trying to ask his question, I will clarify one thing because it is in the chat box. The question is, is it better to have at least 2 meals in a day? And the doctors usually say don't skip the breakfast. Okay, and I will say the best thing is 1 meal a day. There is no doubt in it. Being a practitioner of 1 meal a day, you can see I am healthy, I am comfortable, and I can talk like this for next 4 hours. No problem at all. My last meal was last evening. So 1 meal a day is more than enough, but it won't be suitable for everyone. Say for example, if there is a bus driver or train driver, he doesn't want to take a risk by taking 1 meal a day. He can also take 1 meal a day and do a good quality life, but it's up to them. If you're taking 2 meal a day, have it like a breakfast and have it once in the evening around 4 o'clock or 5 o'clock. Just is 2 meal a day. If you're taking 1 meal a day, the best time is afternoon 12 o'clock to 2 o'clock. Even in Ayurvedam, that is the period where your digestion will be at your best. So the concept of having breakfast as a must is definitely wrong. Being a doctor, I can say. But if you're taking 2 meal a day or 3 meal a day, you should have breakfast. If you're taking 1 meal a day, the best time is 12 to 2. As I said, I am not able to follow because of my hospital appointments and job. I am doing at 5 o'clock. Maybe once I retire, I will do between 12 o'clock and 2 o'clock. If you're taking 2 meal a day, you should have breakfast, another one at 4 o'clock. That is the ideal one.
Thank you. Yeah, thank you so much. Now,
Sir, do you take any liquid food, sir, other times?
Water, plenty of water.
Plenty of water,
Yeah,
any
you
juice?
can't. No juice, no fruits. You can't take anything other than water. Other than water, if you take anything, that will stimulate insulin. Once insulin is secreted, then it is a cycle. The insulin
Sir, do you take
secretion.
mineral water?
No. Normal water is enough. You can take all your minerals and calories needed in that one meal itself. Normal
normal
water is
water.
enough.
Okay.
If you take even a little bit of nuts or one fruit or mineral water which may have sugar sometimes, then what will happen is it secretes insulin. Once an insulin is secreted, insulin gives two informations to the body. The first information is glucose is coming, don't burn your fat and glycogen. The second thing is glucose is coming, store lot of fat. These two informations given by the insulin is the main reason for people getting diabetes, hypertension, cardiovascular disease, stroke, heart attack, everything. The whole metabolic syndrome is because of these problems. If you keep your insulin as low as possible, you should stimulate insulin as less frequently as possible. Say if you are following this one meal a day, suddenly on a day morning 10 o'clock you have a friend who is visiting you, you need to have a coffee or something with that, use that time and eat whatever you can, finish everything and see if you can make that morning 10 o'clock as your one meal and try to avoid your evening meal, or make it like a two meal, nothing wrong in it. The problem is frequency of eating the meal, not the calories or amount of meal. You can take good amount of meal once a day, that is the best method. If you're taking twice a day, that is not bad, but you need to keep an eye on the calorie, because twice a day if you're eating, you may end up taking more calories and your weight won't come down, etc. But we are going away from the discussion of sexual vital fluid, so we can discuss those things on a later day. Let us discuss more about sexual vital fluid today.
But it is coming under Kayakalpa, sir. Food, one concept of out of 5 items, one about food also coming.
Yeah.
உணவு உறக்கம் அளவு 5 அளவு முறை.
Perfect.
However, it's
Okay,
very
sir.
good
Thank you,
discussion,
sir.
sir. Very good discussion. So, we are happy to know that you are having only one meal a day. It's very fantastic, sir. And already our Dr. Sanmugali has given a lot of inputs about the fasting and the benefits he has given that. Surely we will have some other sessions and we will continue that, because it's a very good idea you are giving, because you yourself is an example for it.
Yes.
And similarly, Dr. Sanmugali has given a lot of inputs. We will discuss about the fasting benefits, one meal, two meals, surely. In another 2 or 3 sessions, we will discuss, sir. Really, we are happy to know that you as a doctor, you are having one meal a day and you are energetic and you are giving all the details. Really, we are happy, sir. Happy to know about this. Welcome.
Sir, Variyar used to tell, ஒரு வேளை உண்பவன் யோகி, இரு வேளை உண்பவன் போகி, 3 வேளை உண்பவன் ரோகி, 4 வேளை உண்பவன் போகின்னு அவர் பேசும்போது. Right, sir. Okay, sir. Thank you, sir.
Sir, there is a question in the chat box asking about diabetics. The thing is, if you follow this, you will not get diabetic. So this one meal a day, Aindil Alavumurai, Sky Yoga practices, everything has a role in preventing diabetes. So in the Sky Yoga, Kayakalpa simplified exercises, there are some steps and mudras which will give nice compression to the pancreas so that the pancreas becoming healthy so that you won't get diabetic. So that is prevention. For a person who already got diabetic, it is entirely different. So it depends upon what stage of diabetic they are. If they are just taking tablets like metformin or any other tablets with the help of the doctor, slowly they will try to see if they can take the food at less frequently. If they are taking medicines twice a day, they can have food only on those 2 days. If you are on insulin, it is much more challenging. We need the doctor to help in a very close monitoring so that they can slowly change themselves to 2 meal a day and 1 meal a day. It is very difficult. So if you discuss the person who is already diabetic in a different manner, if you take by the karma, I've already made one video on the science behind the karma, which I did for the Sky Yoga group in Cambridge. The understanding is different. So person who's already got a diabetic, he is having insulin, he is suffering. So by karma, he is supposed to suffer. By making that person to follow the 1 meal a day and make him insulin free and make him diabetic free, we are working against karma. If you have to work against karma, you need to do it properly. I believe that the only way you can work against karma and make a diabetic person properly is by meditation. Agna meditation makes you free of all your aganmya karma. Turiya meditation makes you free of all your prarabdha karma, and Turiyadita meditation makes you free of the sanchita karma. Without meditation, if somebody wants to just follow this diet alone and making free of the diabetes, it won't work, because the karma will find some other way to make sure that it is doing the job what it is supposed to do. So if you have a diabetic person, ask them to enroll into Sky Yoga, follow everything. You can't leave meditation and follow only Kaya Kalpa and Maunam or something. You have to follow everything with proper understanding. Definitely diabetes will improve. There is no doubt in that.
Thank you so much, Jaya. Thank you so much. Now I request Dr. Shanti to ask the question.
Good evening, Doctor.
Good evening, Amma.
Excellent presentation. Easy way to understand each and everyone, sir. It's a great speech. As I want to know one thing, sir, what's the difference between sexual vital fluid and the seminal fluid?
Okay.
Just want to know.
Okay, Ma. This is what Dr. Sudhindra Devi also raised in her inputs. So, if you take a physical body, sexual vital fluid and the seminal fluid, whatever staying in the seminal vesicle or whatever a man ejaculates, everything is same. That's what the allopathy says. That's if you want to take it into the Western world, that's what they will understand. But if you take into the subtle body, the sexual vital fluid has nothing to do with sex. It is to do with vitality because it has got the biomagnetism. It is called as fluid because it has the fluidity, paimapurul. So for the direct answer to your question, if you are standing from the physical body point of view, sexual vital fluid and semen are same. That's it. If you are coming to the subtle body, the sexual vital fluid is not just the semen alone. It is the vitality fluid, or it is the biomagnetism which is stored more in the lower chakras, which you are trying to push into the higher chakras. That's why in the past few years, there were a lot of discussions in the Sky group, not just in India, even outside India, that we should remove the word sexual from that sexual vital fluid because it is not just related to sex, it is related to the vitality and more to do with the subtle body. Possibly when the book comes out, it will give more better answers.
Very correct, sir, because we know that seminal fluid contains everything. That is the seminal plasma and various content like fructose and calcium, like that, etc. But the sexual vital fluid, as Maharishi says, it contains the life force particles which will get liberated from the SVF, and then it get liberated the formative dust particles like that. So I want to know, is there any size, shape for these things? What's the nature of the SVF and what's the nature of the seminal fluid?
Yes, Amma. If you want to understand from the subtle body point of view, there is no size, there is no shape, you can't see. So subtle body is the one you can't see. Say the best example is, say for example, if now I'm smiling, I'm very happy and I'm talking to you with lot of happiness that I'm able to clarify your doubt. But in my heart, I may have a kind of a sad sensation. Oh, today morning I'm expecting a email or expecting a letter. The letter haven't come. It's already almost like in UK time, it's almost going to be 12 o'clock, almost 12 o'clock. I think the letter is not going to come. So that's a small sadness, maybe inside my heart. But when I am talking to you, I may be smiling and I may be talking. So my physical body is smiling, but the subtle body has got that sadness, which is very personal. So subtle body, if you take that Paimapurul, what Maharishi has mentioned, it has no shape, it has no size or color or anything. All it has is the vitality, and the vitality is also can be called as biomagnetism. வாழ்க வளமுடன்.
Okay, sir. Then coming to the traditional system of medicines like that, all the Siddhas and Munivas had explained already that 96 tattvas are based on the human being chemical constituent, a total working mechanism. In that 96 tattvas only, the 7th dhatu they had told. And this coming to the 7th dhatus, this juice, blood, flesh, fat, bone marrow, SVF and all these are coming. And our Maharishi says after the SVF, it will get converted into the energy particles, which are the coating layer and the vital fluid, and like that the biomagnetism will arise. But coming to the point, if you are in a scientific manner, can you correlate
Sorry, Amma, I think your audio got disconnected, but I got your question.
these 96 tattvas, and is it possible, sir? Is it possible to connect all these things? Hello?
Yes, Amma. I got your question, Amma. It's definitely possible to connect all the things, but you can't do it with the physical body. So if you're asking me to do what is the connection from allopathy point of view, in the physical body point of view, it is very difficult to connect. For example, in the physical body, if somebody says that the seminal vesicle or the ejaculatory fluid is coming from the bone marrow, that itself is wrong. Bone marrow is different, the seminal ejaculate is different. So physical body is entirely a different concept. You can't explain any of that 9 dhadus in the physical body point. But if you explain from the subtle body, we can easily understand, and we can explain that okay, one form is changed to the other form, and finally we got the sexual vital fluid, which is the main biomagnetism in the lowermost chakra, from where the vitality Paimapurul released when you are doing the Kayakalpa exercises. So you think from subtle body point of view, not from the physical body point of view, or think both. If you think only physical body, it won't cause the correct meaning.
Very correct, sir. Because the major portion of the marrow in our human body is mainly what's the organ is the brain. So after the age of physical maturity only, a lot of portion of the SVF and the life force particles remains in the brain and come to the lower area. So however, according to Maharishi philosophy, where was the SVF located, sir? Coming to our Maharishi philosophy, sexual vital fluid, where was it get located?
Yes, Amma. If you take from Mageshi's principle, I will explain only from the subtle body point of view. From the subtle body point of view, the sexual vital fluid is located in the lower chakras like Muladhara chakra and Swadhisthana chakras, and that's what we are trying to churn and produce the vitality and push it up in the subtle body. In the subtle body, we have got like thousands and thousands of nadis, of which 104 nadis were important, of which 3 nadis were important: Sushmana nadi, Ida nadi and Pingala nadi. And we have already discussed once that the Ida nadi is more of parasympathetic, which is the good one. The Pingala nadi, or the right side one, is the parasympathetic one, where we need to reduce the stone. All these nadis join together at the Agna chakra. From there we have the Sushumna nadi alone traveling. So the whole vital fluid concept will apply only to the subtle body, where we have the vital fluid in the lower chakras. By using the Kayakalpa, we can push the vital fluid to the higher chakras by using the nadis. If you are using the nadis, then there is no color, you can't see them. Even if you dissect a human body, you can't see the nadis because they are all in subtle body. But if you want to say something equivalent in the physical body, as I explained once before, the equivalent to that is you can take like the vagus nerve, which is coming from the brain all the way to the bottom. So vagus nerve is a good parasympathetic nerve. That may be one of the conduit like Sushmana nadi. The other one is the sympathetic tract, and the lowermost in the Muladhara, there is a pudendal nerve which comes from S2, S3, S4. There is a full presentation on science behind the Kayakalpa I've done 1 month back. I can even share that in the WhatsApp group of your teaching.
Thank you, sir. Thank you. The forthcoming years, is it possible you can do a lot of things correlated to the scientific manner about all these our Maharishi's philosophies along with these things, sir? Thank you so much for your excellent presentation. Thank you.
Sure.
Thank you, Ma. I request Dr. Surendra Sevi Amma to speak.
Volga
give
Valambudan.
her suggestions.
Volga Valambudan. Shanti, for your question, that is what we're all searching for now. And about the 7 dhatus you talked about, dhatu is a formative tissue, that is, tissues that form the body. But there has been a lot of misunderstanding because they thought that one comes from another. That is why Dr. Ananda also said, no, when from the bone, if you say from the fat you got the bone, it's not possible. So the correct view is that from the food that we eat, the whole essence comes out as rasa. And from rasa, then the blood is formed. So from blood, the muscle is formed. From blood, the fat is formed. From blood, whatever is required, like for the muscle, it takes all the proteins and forms the muscles. All the fat tissue is there in that it takes and forms the fat. And the calcium and phosphate and all that takes and forms the bone. So like that, everything comes from the blood, not one after the other and not one from the other. So if you take like that, it goes from a very gross state and each one is going to a subtler and subtler state. And that's why when you come, the subtlest thing is the semen. So before that is the nervous tissue, majja. Majja is the marrow and the nervous tissue. So then even subtler than that is the semen or the vital fluid, we calling it now, but it's actually the semen, that is the equivalent. And along with all that, what you have is something called the prana or the biomagnetism, because from there only everything came. See, everything came from the metaphysical unmanifest state, then to the physical or the manifest state. So with all the food you get, the prana is coming along with every state of it. And after the semen is formed also, whatever energy is left over is formed as the ojas. So we all say Kaya Kalpa, everybody says ojas breath. But can anyone say what is ojas? Once somebody gave a presentation some time back, but nobody has explained what is ojas. So ojas is that energy or the prana or the biomagnetism left after forming all the physical structures of the body. And that is ojas. And my talk in the next meeting is going to be about ojas. I have already given in this group, but this ojas energy only makes this, Dr. Ananda, how he said, this energy, if it is not lost, but if it is reused in the body, instead of going down, if it's going up, see, Apana Vayu makes it go down. Apana, the thing is reversed. See, the prana, direction of prana is from above downwards. That is the breath. So the direction of Apana is from above down outwards. So that is responsible for all the excretions, the mala, mudra, and then the semen. So if the Apana Vayu is reversed, that means this energy is not sent out, and if it is taken up, then it is all these things are possible. That is evolution of the chakras, and then the energy reaching the brain and all that. So for that sexual energy is one of the big drain. So if there is a mechanism by which the semen itself is not formed, or the menstrual blood itself is not formed, and the whole energy is converted into ojas and then stored in the body or taken up, then all these things. This is how it should be explained. But there's a lot of connection between vital fluid, sexual, and then semen and all that, because so many, all the yogis, all the siddhas are all men. So they did it like this. Of course, still we don't have exactly what is the correlation or the medical thing for the ojas. So that's one thing. If we resolve, I think this whole issue will be resolved. In the next meeting, I will be talking about it.
Thank you, Ma. Thank you.
Shanti.
Thank you, Ma.
Thank you, ma'am. Thank you, Valambudan. Now I request Dr. Shanmugavelu Ayya to give his views.
He left already.
Valga Valambudan.
Yes, Ayya. Valga Valambudan.
Actually, what I am feeling is still we are beating around the bush. Still we are not able to clinch the diagnosis. That's why we are coming around, and finally we are missing the point. So let us wait for some more time. because there are two aspects. One is manifested energy and another one is the unmanifested energy. From the manifested energy goes to the manifested energy, and unmanifested energy comes into the manifested energy. This point we are not able to prove scientifically, but still it is happening in the physical body. That is why we are interconnected with the universe in all the aspects. In one way, our body is Maya. It's not true. That's what we should understand. We are completely operated by a different energy from the universe, and we are going according to that only. So we have to think more in terms of assumption rather than in scientific way. That's what I feel.
Thank you so much.
I think Sondra madam can give a comment for my talk, because for the last 6 months we are struggling. We are not able to prove, because sexual vital fluid and seminal vessel fluid we are able to correlate. But what I am telling is, when the life can thrive, because semen cannot thrive after some time, ovum cannot thrive sometime, but when the semen joins with the ovum and something happens in the uterus for their survival of 100 years. So what is happening of
Doctors think I will talk this doctor. Hello.
in
the doctor's meeting next week.
And what is happening in the uterus is more important, because that is one more.
Why your voice is breaking? Maybe internet issues. You are not audible.
Okay. I think I'm trapped. I think now it will be audible. And perhaps we can, as our madam said, we can discuss it afterwards.
Shanmugam sir, what you are saying is correct. We are coming around the point, but however we are getting more details.
Yes, sir.
We are getting some more details also, sir.
Yes, sir.
Somehow we will come to the exact point of some time. So we are coming around, but we are getting more and more details. I'm sure after some time we will be reaching the point one day. We want to, quickly. But however, we are getting more details.
Yes, sir. That's what happening in every science. Finally, we are coming to a dead end, and from that we were not able to progress. That's
surely, sir, with all you, the doctors and the experts, we will come to the exact point one day, and we will get it what we want, sir. That's why we are coming around.
Yes, sir. There will be one day a breakout. That will be there. Yes,
so that is the day we want, sir.
With that hope only we should pursue.
Yeah, we are
moving positive. Yes, sir.
Actually, I remember Dr. Perumal, when we started, he said, even if it's going to take 1 year, we will do this, he said. I said, I thought, what we are going to do for 1 year? By 2 or 3 months, we should finish the book, I thought. But now it is 11 months, and we are still, Dr. Shanmugam, what he said is right, we are still in the same square. So we should move forward and then finish it, I think.
But every time, doctor, we are a little more enlightened. Every time, we are a little more enlightened. And whether you enjoy it or not, we are all people enjoying it. We are getting more and more details. Really, we all people enjoyed it.
But I think it's been too long, I think.
Well, we'll let it be there. We'll let it be. Already we have wasted some 70 years. So, another some more years, we'll waste for this one. We'll get some more details. At least we will give a book. Our future generation, let them enjoy it. Let them analyze everything. So for which we will prepare a book for them.
Okay. I may have to leave now. Thank
you, ma.
Santi, is there any more questions?
A question from me, sir. What about cloning? What happens in cloning? There is no sexual, if the sexual vital fluid is present all over the body, So a tissue or a cell, even they do this cloning from a tissue, any part, tissue from any part of the body. Could Dr. Ananda explain in this?
Yes. So Shanti Amma, what is happening in cloning is, to understand cloning, we need to understand that meiotic, mitotic, the one which I used. So just to recap, mitotic means one cell will divide into two cells, but both the cells will be as similar to the first cell, that is mitotic. Meiotic means one cell will divide into two cells, but the chromosomes will become half. The 46 chromosomes which is present in 23 pair will become just 23 chromosome. There is no pair. So a man produces sperm with 23 chromosome, a woman produces ovum with 23 chromosome, both join together to produce fetus. This is the normal child formation. In cloning, what is happening is, we take a cell, there is no meiotic happening, there is no division of the chromosome. From that cell, we will be able to produce entirely the similar person just by initial mitosis itself. Because of that, the dolly, the sheep which was first cloned, if you take one cell from the sheep and produce another sheep, the sheep will be exactly the same. There is no half coming from somewhere to change it. So if the first sheep is supposed to have diabetes in say 2 years, 3 years of the sheep life, the dolly, the cloned one, will also get diabetes. It has the same imprints, same genetic malformations, same goodness, same badness and everything. The cloning is completely banned in human, because in human people will then start doing like cloning of one person, so that the person, when he gets old at 70 or 80 and if he dies, he can clone and produce another child, and that creates unnecessary ethical problems. So cloning is not legally permissible in human beings, but in plants, animals and rats and sheep, as you may know, everything is already done. And in cloning, what is happening is, there is no sexual fluid, there is no male or female. We can just clone and produce another, like a replica, like a Xerox. வாழ்க வளமுடன்.
வாழ்க வளமுடன். Thank you.
வாழ்க வளமுடன்மா.
வாழ்க வளமுடன். வாழ்க வளமுடன். Yeah, thank you so much.
Am I audible now, ma'am?
Yes, you're audible. Now you can ask your question,
Okay.
Harjun.
There was some technical problems. Thank you, ma'am. Thank you. Sir, வாழ்க வளமுடன். Beautiful presentation, an enlightening one, I would say. My question is, Swamiji has given a meditation called biocurrent or transcurrent meditation, which is being done between husband and wife. So this is something which happens on Manivinala Vedpanal. So my question is that, what is the effect of this transcurrent meditation on the hormonal levels of this luteinizing hormone or the follicle stimulating hormone? How does it have an impact on the production of the spermatozoas in the sexual vital fluid? That is my first question, because one of the senior professors have stated that Swamiji has given this meditation to moderate the sexual activities between a male and a female in their family life. So I just wanted to know what is the impact it has on the these hormonal levels.
Sure, Arjun. I can talk this. This is a topic on its own. As I said, scientific basis of Varthum Payanum itself is like a 40 minutes, 50 minutes talk, where you can understand what are all the hormones which are secreted or which are activated when we wholeheartedly bless someone. So in Maharishi's concept of the husband and wife, who are just blessing each other, and the meditation what you mentioned, what is happening is, the husband should wholeheartedly accept the wife, accept the efficiencies, accept the deficiencies, and take her as the part of the life. Because if a man has got some problems in the life, and if a man has to undergo some bad things in the life through the karma, usually the karma plays first through the wife, then through the children, then the neighbors, friends, parents, family members, like that. So if you are in a good amicable biomagnetic relation with your wife, that makes your karma weak. It's like reducing one of the hand of the karma, so that the karma is not able to do its work through the wife. I'm saying wife as an example. You can take it as a spouse. So for a woman, the karma will work through the man. For the man, the karma will work through the woman. So either way, it is important. That's why that meditative process of blessing someone who is close by is very important. In our Varth also, we always bless the spouse, the children, and even எதிரிகளாய் எவரும் இருப்பினும் கூட we are going to bless on them. So there is a definite relation. It produces the hormones like one of the previous speakers mentioned about all the feel good hormones, dopamine in the physical body level. In the subtle body level, it produces good biomagnetism. So that's what the Swamiji usually say. If you are following this, you will get a kind of the face and appearance. You will start attracting the people because your biomagnetism is pure. It's not because you are looking like a Rajini, or if it's a woman like a Nayantara or something like that. It's because your biomagnetism is so pure, you are able to attract. How Ramana Maharishi has attracted so many people, because the biomagnetism is pure. There is no hidden agenda. His aim is everybody should live happily, peacefully. So if you have that peace in your mind and able to spend that with your spouse, that creates that good biomagnetism. If in that process, if you think that I should not waste my ejaculatory fluid, I should have sex maybe like once in 2 weeks, I should moderate everything following the Indilalamurai. If you follow that, that biomagnetism spreads to your partner, your children, and your partner's interest in the sex also will get moderated. And they will also, even if they are not even following sky practices, they will indirectly start doing this Indilalamurai. So for example, in my family, this once a day eating food, one meal a day, it's not only me, it's me, my wife, and my daughter. This is impossible if somebody is doing alone. Then it becomes a lot of confusion. My wife don't know how to cook, and I'm making such a nice breakfast with lot of pongal and ghee and cashew nuts and everything. You say one meal a day and you don't touch it, and you want to have it 5 o'clock in the evening. That creates unnecessary displeasure in the family. So in my family, we have only 3 people. My parents are in Chennai. So me, my wife, and daughter, we all 3 do the same thing. So Aindilalamurai, we all do the same amount of Aindilalamurai, Kaya Kalpa, exercise, everything in the same manner. If one person is doing, the others also will follow that. So that's what Maharishi is doing it in that Pengal Vadakam Sollum Naal, so that we create a nice atmosphere that will help in everything. Not just your sexual moderation will happen between husband and wife, food moderation, getting anger, everything will get moderated. வாழ்க வளமுடன்.
Sir, so my doubt is like, in Durya, when they are initiating us the Durya state, the teachers look into our right eyes and they pass the biomagnetism through our eyes. And in similar way, when we do this transcurrent meditation, it is the interchanging of biomagnetism from both of them eventually. So the wife will also gaze into the husband's eyes, and the husband will gaze into the wife's eyes. So is there any connection? Because in order to get the pineal gland, spiritually, in subtler aspects, to open the crown chakra, the teachers are gazing into our eyes. Is there any connection? That is why I'm asking, is there any hormonal level of impact so that, your pineal gland could work, and that will make the follicle stimulating hormone to reduce, and that will lead to a moderation? So as in, like, it is relatable to the whatever effect is happening in brahmacharya, can it be equal to the effect which is happening when you're doing the transcurrent meditation?
Definitely. So what is happening is, when the spouse, husband and wife, look at each other in their eyes, both the eyes, when you are looking into the eyes, what is happening is the optic nerve goes behind and it crisscrosses and then goes to the opposite side. And the pineal gland is so closely related to the crisscross of the optic nerve. That's why when you are seeing a person with eyes and talking, that's why they say, even normally, if you go to a buy a pocket of milk, talk to that shop person in the eyes. When you speak to anyone in the eyes, you can control them. They will never cheat you, or even in fact, you can control them very well. So it has so much of power that will have a direct spread of your biomagnetism to their pineal gland and pituitary gland, so that nobody can cheat you. And the right eye is much more important. So in Deechai, why we are doing the right eye is, if you see even in the Diva Pairchi or in the Kannadi Pairchi, Maharishi used to say that when you are closing your eyes, you try to focus more on your right side. There is one meditation which is, I don't think, linked to the Sky Yoga meditation, where the whole meditation happens just by closing the eyes and focusing what is happening behind the right eye. The reason for the right eye is, right is always the dominant side, and the dominant side, if you are stimulating well, that will stimulate the pineal gland and pituitary gland much better. So that's why in Turiya meditation they see the right eye. Even in normal meditation, when you close your eyes, if you are doing a Agna meditation, you can also do by focusing behind the right eye. That will work much better. It all definitely has a link on stimulating the pineal gland and pituitary gland. Once the pituitary gland, which is the master gland, once that is controlled, as I have seen, pituitary gland secretes the luteinizing hormone, follicular stimulating hormone, controlling the testes. Similarly, it secretes adrenocortical tropic hormone, ACTH, to control the adrenal gland. So all the glands are nicely controlled, and you will get a good homeostasis. Yeah.
Thank you so much, sir. Bye.
Now the audience, any questions from you? Anyone can raise their question.
Sandeep, the questions are no more. I think we can come to some conclusion. Because
Yes,
doctor already is busy with his schedule. We have made him stay here for more than 3 hours. There are no more questions. I think we can conclude and give the vote of thanks.
Okay.
And we'll make the doctor continue the session, discuss with him and continue the session later on.
Okay. So I request PhD scholar Harjun to enter the vote of thanks.
It gives me an immense pleasure to deliver the word of thanks. I thank Hema Malini ma'am for conducting a beautiful meditation. I thank Dr. K. Perumal sir for being a bridge between the PhD scholars and the resource persons and delivering a welcome address. And next, the man of the moment, who is Dr. Ananda Kumar Dhanasekaran, who delivered an important, enlightening discussion about sexual vital fluid and Kaya Kalpa. Thank you so much, sir, for showing your presence today amidst your busy schedule. And I also thank the guest of honor, Dr. M.B. Rabindranath, sir, Director, Project, WCSC Director of Vision for Wisdom and R&D. And I love to thank a pioneer, who is Dr. A. Jayaprakash, who is a plastic surgeon and age management consultant from London, and Dr. Swatantra Devi, MBBS, MD, Sri Hari Hospital, Sai Baba Colony, Coimbatore, and Dr. T.T. Shanmugavelu, Meera Nursing Home, Hosur. So I love to thank everybody for showing presence, and none other than our PhD scholars and thinkers, the erudite thinkers. I thank all of you on behalf of WCSC, Vision for Wisdom, for showing your presence for this Kaya Kalpa webinar. Thank you so much. Varika Vayagam, Varika Valam.
Thank you, Arjun.
Varika Valamudan, Santi, before conclusion, so we are having a personal contact program for the scholars from 4th May to 8th May. I request all the scholars to attend. I request the experts and doctors, if possible, you can also make a visit and you can meet the scholars directly. Around some 30 scholars may be coming there. If possible, Dr. Sundara Devi and Shanmugavelu, Dr. Rabindranath, if possible, you can make a visit between 4 and 8 May. You can meet the students directly. If necessary, we will arrange a separate class also for you if you are coming there. Thank you very much for all the doctors cooperating there. Valga Valamudan, Valga Valamudan, Valga.